Then comes the fungal infections. Superficial fungal infections are getting very, very common in our OPDs. So, three groups of disease we are getting: dermatophytes, superficial ringworm type infection, Candida albicans, yeast infection, and Pityriasporium. Okay. So, superficial, cutaneous, subcutaneous, systemic, and opportunistic. Superficial mycosis, that Pityriasis versicolor, very, very common in OPDs. That's pigmented lesions, mostly on the trunk of the body. Tinea nigra, gray to black discoloration, macular lesions on the palm also. Black pyrrhora, that is in the head. That's as a lice infection, you can see. If it is white, it is white pyrrhora, and as black in color, you can see that. So you take a bunch of hairs, and just if the patient is coming like that, just say take a small scrape and do like scraping. If it is completely peel off, it is a local superficial mycosis of the skin. With a microscope or with a wood slab, you can see that. Cutaneous infections, nails and hair, you can see. Subcutaneous infections, maybe through the ulcerated lesions, you can see that. Systemic, it's very, very common. Immunosuppressive patients like HIV infections or AIDS patients, you can see systemic fungal infections. Same also, opportunistic mycosis also very, very rare with the HIV or AIDS patients. Like patients that PLWHM is patient living with the HIV or AIDS. Like that, the opportunist mycotic infections you can see, candidiasis, aspergillosis, all these things. And the things what we are getting in OPDs are superficial fungal infections. That's tinea infections. First one is tinea corporis. You know that we are getting very, very common disease in the summer season, also in the winter season. That's corporis is a ringworm infection of the body. Anywhere in the body, tinea corporis. In the groin, it is called as tinea cruris. In the foot, tinea pedis. In the nail, tinea inguinum. And the scalp, tinea capitis. Tinea corporis, like that. As a circular patches, mandalakara, pidaka with elevated edges, pearly like arrangements of the this one. You can see, it's a round in nature. You can see the edges with the round thing, demarcated, elevated lesions. Tinea corporis. Any of these way lesions can see. Maybe it starts from the genital area, spreading to whole body. Start from under the breast and spreads to whole the body. Maybe starts the armpits and spread to another folded areas. It is tinea cruris. It is in the groin region. We are calling it as jock itch. And more sweat, more hot can cause this, especially in obese persons and those who are having more sweating. And maybe spreads to groin, genitalia, and perineum area. And ask them to use cotton dress, loose dress, and personal hygiene. See this, you can see. You can see like this. These all are jock itch. See this type of lesions. So all the tinea infection we are treating almost same way. That's why just we'll conclude the treatment last. And tinea pedis, athlete foot. As I told, the skin is, we should hydrate from the inside, but we have to keep the area dry. Okay. So whenever the foot is contact with water always, from that we are getting mostly the athlete foot, tinea pedis. Dermatitis will be there, peeling of the skin, maceration, fissuring in between the toes. As our Acharya is also telling the same thing, Dushta Kardama Samspashat, Kandu Kledanvidam. Here also you can see Kandu will be there. Itching will be there. Dermatitis, peeling. Every day, where we can see Andarangulyo in between the fingers, between the toe cleft, you can see. Beautifully, he is telling about the Alasa. Kapapittahara line of treatment you have to adopt here. Padola Kadurohinyadi Kashayam, Kulagadi Kashayam, Aragudadi Kashayam, you can use. Tribhala Kashayam Shalana for a particular portion, area. Else, you just take the Haridra, make it a Kashaya, just use that for the Shalana purpose. Our Acharya is telling Aranala Kashayana Thara. You can use Dhanyamla Kashaya Thara for the recurrent tinea pedis condition. Naligera se Tailena Poshnena Virishaja. If it is after it is completely healed, the oozing is stopped, you can use Naligera Taila for the Thara purpose. In the same way, Muruvenna ointment also you can apply for preventing the secondary infection, recurrence. Lakshadi Churnam or Laksha plus Haritagi, we can for the external application or external Thara also you can use that. Sashapadaila processed with the Brihati or Kantagari can also use for the Thara purpose. Jadi Patra Kalkalepana. Take the Jadi Patra, that's we know that. That is Vrana Shodhana in nature. Nisha Dhatri Kashayena Parishego Alasaga Hitaha. Take Nisha, take Amalaki, make a Shaya, and do the Kshalana. Rajani Tilakalkamcha. Shodhanartham Prashaside. If it is more sloughy, you just take Haridra mixed with Tila, and this can the same you can use for the Shalana purpose. Chatyadi Thara, Amalaki Kashayam, half part ghee, Eshti, Jivandi, Maladi Patrakalkam, Madhujishta, Sarjarasa, Malaharas. You can use for the any Malaharas like Rasotamadi also. After the oozing condition stops, you can use external application. So practically, you can use Haridra Kashaya Dhara, Dhanyamla Dhara, Kasisa Padola, Gorojna, Tilanimba Patra, Lepanam with the Dhanyamlam. Aragudha the Kashaya Dhara. So dry the local areas. This again, Tinea capitis. So when a person is coming to you like this, you may be confused with the seborrheic dermatitis, because in seborrheic dermatitis, mostly on the sebum produced areas, on the scalp, on the eyelids, on the eyebrows, in the nasoauricular part, on the chest, you can see the lesions. But in the case of tinea capitis, round patches with itching, with oozing, with the pedaga, you can see. But in the case of scalp psoriasis, elevated red marks with the scalings, you can see. Okay. If it is dandruff, not much erythema, no swelling is there. So it may not be dandruff. Dandruff is a physiological condition. Tinea capitis. Like this also can. So examine the lesions, find it the borders, and diagnose it and go for the treatment. If the tinea capitis comes, we are maybe treating as Indulupta also. So examine the area very thoroughly and go for the treatment. If you're using only Kshalana, Aragudadi Kashaya Kshalana, or Vidanga Kashaya, take Vidanga, make it Kashaya and go for the Kshalana. We can treat it as Arumshiga, Pitta, Kapha, Rekta, Krimi involvement will be there. So Acharya is telling the Lepana with Haridra Padol and Imba Vatra with the Saindava. Just make a Kashaya with the Haridra Padol and Imba added with Saindava and do the Shalana. It's very good, very that reduces the inflammation, reduces the itching, reduces the spreading. Again with the Kushta, make a Kashaya with the Kushta. You can do the Shalana. So you can mix Kushta and Vidanga and make a Kashaya and go for the Hara. Tribhala Shalanam. Almost in our old OPD, we have Tribhala. You can use practically Tribhala Kashaya Dhara. Nirgundiyadi plus Nimbadi Kashayam. You can give internally. Trimikinavadika you can give. After the lesions can be treated, well, you can use Malatyadi Geram for preventing the secondaries. Eladi Geram also you can use the same. Eladi Kashaya Dhara also you can use for the in Shirodhara for the Tinea capitis. Siddharthaka Snana Churnam is very good. Kashaya, you can take the churna, make a kashaya, and go for the kshalana or go for the khara. And for cleansing the scalp, take pada leaf, marija, pallava, marija patra pallava. The tender leaf of maricha, not the tender leaf, somewhat mature, not completely mature. Take that leaf, take pada leaf, make a paste and use it as a shampoo for preventing the secondaries. Then comes the nail infections of the fungal infection of the nail. Onychomycosis is a fungal infection. So whenever there is more humidity, the chance of the microorganisms growth. Like this, you can see the infections. Fungal growth below the nail tip. So these changes you can see. Distolateral subungual, superficial white, total dystrophic onychomycosis. See these changes you can see for the fungal infection. So keep it dry. Use Haridra Kashayam for the Kshalana, Tripala Kashayam for the Kshalana, and make it dry. And Guggulu Marichadi Tailam. If the oozing control is under control, you can use Guggulu Marichadi Saila for the external application to prevent the secondaries. And Mahatiktaga Grita Lepam. I mean that ointment you will get. Mahadikta Gridam added with the Tutham you are getting for cleansing the wound and also for making the preventing the secondaries you can use. Paranoia also same treatment. So we are treating it as Chippa, Akshata, Upanatha. Pittavada is a dosha predominant, maybe associated with the Jvara and Paga of the Nakamamsa. And if it is Abhigada Janyam, the area will be dark in color. Other one, it is like a this yellowish discoloration you can see. Okay. So you can go with the Rektamoshna, you can use Jalogavacharma, Virejana, Ushnambu Parishegam, and if it is more pus filled, go for Shastra. Triphala Kashaya Tuttha added with the Tuttha. So wound cleaning, Ropana, and also makes the area become fast dry. Mahadikta Levam, Gairiam Haritegi Kupili Dhara. Here also you can use. Complete if it is a more that's water, maybe chance of this fungal infections of the hand, maybe other else spreading from the other part. So in a tinea infections, it's completely spread from one part to another because it's superficial. If you are scratching with your nail, spreads to that. If you are rubbing with your skin surface, again to spread to that particular area. So both dorsal and palmar aspect, there's a chance of coming of fungal infection, that's tinea manum. Tinea barbae, that's on the beard areas. Tinea facial on the other part than the beard areas. Perioral dermatophytosis on the that auricular part. So from KH solution, you can prepare, you scrape the skin and you can put in that and observe through the microscope. You can see that the fungus is moving. Then comes the yeast infections, the Pityriasporum and Candida infections. Like this, like that hypopigmented lesion and hyperpigmented lesion. Some persons with the white lesions, some persons with the dark pigmented areas comes. Okay. So this is all the pityriasis vesicola, that's this infection. Picteria versicolor in head, it is called as dandruff. Tinea versicolars can be anywhere in the body. That's a warm and humid environment where there it is, where all the chances of getting tinea infections. So on the back, on the chest, candidiasis, Candida species of fungus. What's this? Maybe if untreated, can cause some gastrointestinal damage also. Some type of if immuno persons also can cause some secondary infections. Candida lindatigo on the fold of the skin you can see. And in the tinea infections and the candida, in the pityriasis versicolor, in all, we are adopting the same treatment. Okay. So the Dhruhara line of treatment in all these conditions you can use. So, the Dhru, we have to adopt Krimihara line. So you can use Nirgundyadi Kashayam, Krimikravadika, Vilvadi Gulika. Here the Kaphapitta Shamanam. In the tinea infections, if the secondaries like there Kaphavada will be the predominant. The secondary stages Kaphavada will be the more predominant because the continuous itching, continuous rubbing, that area becomes so hard, so black in color. You can notice that the patient coming with the continuous jock itch, continuous irritation on the under the breast or under the arms. So the area becomes dark in color. Somewhat the skin texture will be changed and it's hard and raised. So first stage Kaphapitta, later it can be changed to Kaphavada. Okay. The Nimbapatradi Churnam, just make it boil it with buttermilk and go for the external application. Eladigana Churnam, same with the buttermilk help to maintain the skin pH. When the pH is become less, when the pH is become more, these two causes the infections. So we have to make the skin pH in 5.5. So that's that buttermilk helps to maintain the pH. So any labors what you are giving, you can give with the buttermilk. Okay. Else you can give with the lime juice. Siddharthaka Snana Churnam, make it a paste with buttermilk or with the just make a boil with the buttermilk and that paste external application, or boil with water. You can do the external application. Very good to treat the superficial fungal infections. If the whole spreaded also, you can do as a thara, takra thara with the Siddhartha Snana Churnam. Or Siddhartha Snana Churna, as we are doing the Nyavara Tepa or Nyavara Kali, the same thing. You can do the rubbing, the scrubbing with the massage with the Siddhartha Snana Churna or Eladigana Churnam or Nimbapatradi or Nimbaharidradi boiled with the buttermilk. And Neeli Daladi Geram. After the lesions are completely cured, you can use Neeli Daladi Geram, which is explained in the Ludavisha Prakarana for preventing the secondaries. You can use this Pamantaka Thailam for preventing the secondaries. You can use Nugulumarijadi Thailam for preventing the secondaries. Okay. Or Malaharas you can use. Mahanimba Patram. Mahanimba is a very common drug you can see in our surroundings. That's a very best drug to treat this if you are giving any dharas. Or the same thing you can give the kashayam internally and the same kashaya dhara you can give externally. The same thing you can make takra and go for the external dhara purpose. Or Tangana Basma with the lime juice for the external application. It maintains the pH, removes the excess bacterial growth, fungal growth from the superficial skin. Chakramarda leaf, Acacia tora, Chakramarda leaf internally and Chakramarda leaf with the buttermilk externally. Arogyavathini Vadi, acid contains Gandhaga, Tribhala, Kadugi, Nimba, Halfodhvararopana, Vrashodhana, Krimihara, immunomodulator in action. Krimi Mudgara Resa, Gandhaga, Vidanga, Ajamodaga, Kuchella, Palasha. It's good for treating the Mandakni, Brana, Vibandha, Kushtahara, Krimihara in nature. Gandhara Rasayanam, Deepanam, Pachalam, Krimiharam. Gandhaga Rasayanam having the keratolytic action. If the lesion is hard, it becomes dark and very dry, you can give Gandhaga Rasayanam for the keratolytic action. Nisha Amalaka Churnam or Nisha Amalaka Divadi. Shamalaka is telling in Kushta Mahakashaya Prakarana by Charaka. So these combinations also can give as a follow-up treatment for the patient to use. Chandrakala Lepam, which contain Madhuchishta, Shweta Maricha, Narigela Thailand Karpura. It's very good to remove the excess growth of the fungal from the superficial skin. Because this having Kadutikta Rasa, Ushnavirya, Kledopa Shoshana in nature, Kanduhara. Mandara Lepa, actually it is telling in the Lukta and all, having hibiscus, wax, Narigela Bhasma, and is good for dandruff and also the fungal infections of the skin. And some patent drugs, Trichoderm, Sridev, Actaril soap, KK labor, Konela Kadakadi labor, an antifungal cream of Himalaya, cutis powder, cutis ointment, cutis soap, dermocharge powder of thymine, etc. We can use for preventing the secondaries.